Hi, my name is Dr. Brett Zemba. I'm a chiropractor here in Louisville, Kentucky. What I want to make a video on is how a chiropractic adjustment could help a child's ear infection. It was stimulated this morning because I had a patient that came in. I adjusted her a week or two ago. For a year and a half, she had reoccurring ear infections. The parents ended up putting tubes in the ears that ended up not working. They kept coming out. Ear infections kept coming. After an adjustment, all of her problems seemed to be gone. I've seen this multiple times in the office, and it's almost miracle-like, to be quite honest. The thing is we just need a simple explanation to close the gap on how a chiropractic adjustment could help with something that most people wouldn't relate to it. Okay, so I need this model to help. You need to keep in mind that the ear is not on the spine, but this is the hole that we hear out of, okay, that indentation in the spine. Now, just around the other side is the skull itself and the upper vertebrae of the cervical spine. What we've noticed a lot of times, sometimes just being inside the mother, or sometimes it's the process of birth itself that can be very traumatic, not only to the mother but to the child. Most children experience a subtle misalignment of the upper neck and skull. How is that related to the tubes that drain the ear? It's very simple. The tubes that drain the ear are right next to the vertebrae. When these bones slightly go out of place, now it does interrupt nerve messages, it interferes with the brainstem, it interferes with the muscles, ligaments, and tendons, but for this video, how does it affect the tubes that drain the ear? Well, when you experience a misalignment of these bones, it influences negatively all of the tissues. Since the tubes that drain the ear are right next to it, what it does is it clogs the tube. When we are very young, the tubes that drain the ear are very horizontal. Fluid doesn't go down things that are, flow down things that are very horizontal. So on top of a tube that doesn't like to drain well anyway, then you take a misalignment right next to it, it clogs that tube. When the tube gets clogged, it cannot drain. Fluid stays, it gets infected. If that reoccurs over and over again, they usually put a hole on the outside of the eardrum to allow the fluid to drain. If the fluid's not in there, it's not getting infected. So when you take a tube that's already hard to drain and then you have the misalignment right next to it, that's what it does. It clogs that tube. If you can realign the neck, take the pressure off of the tube, then the tube will naturally drain. As children get older, you always hear a parent, well, they eventually grew out of their ear infections. Why? The misalignment is still there, but as we grow, the tubes descend. So even if the tube is slightly clogged, it typically drains anyway because it flows better with gravity. So really it's simple. It's a very simple procedure on how to realign the children. There are no x-rays taken. I usually just gently palpate the upper cervical spine. I can feel if it's misaligned with my hands. And then with a very gentle instrument, there is no popping, there is no twisting, there is no jerking of the child's head. I place it on the spine where it is misaligned, gently make an adjustment. Again, it's painless, they don't even feel it. And then the bones go back into place. If the adjustment goes into place and truly stays there, then the pressure is taken off all of the surrounding tissue. For this video, we're talking about the tubes of the ear, and they open and they drain, and it literally is like a miracle if that's the problem. So the idea of this video is to get that information out here. Share it with friends if you can, especially if you know some that their kids are going back and getting reoccurring ear infections, getting tubes in the ear. It's a great first step before any medication and a great first step before any surgery that has to be done. Thank you very much.